everybody. Thank you for anyone who's joining us or watching this maybe after the fact. We're super excited to have Azita here today. I'm going to have her introduce herself, tell us kind of who she is, where she's from, and then we will dive into today's episode.
Awesome.
Azita,
Thanks so much.
off to you.
I'll handle the last name part.
Yes.
So it's Azita Nejaddehghan. It's not as bad as it looks, but it always intimidates people. So anyways, as far as my bio, I'm a PT and strength coach by trade. Have done a little bit of both, I would say. Have had roles in both sectors, some overlapping, some isolated. Stemming from back, my first job after school was in private care as a sports PT, and then I sort of transitioned out into college football as a pure strength coach, more doing a lot of return to play stuff. So definitely using that PT background. And from there went to the St. Louis Cardinals organization out of their rehab complex down in Florida, which was definitely not a bad spot to live in. And then from there, I took a interesting role with the XFL because that was a new league at the time. So was a really cool experience to be part of. Very difficult, I will say. But if you ask anybody that's worked in sports, there's pros and cons to being a part of a place that has established systems, and then there's pros and cons to being a part of a place that you're a part of building those systems. So that was a unique experience for sure, kind of building from the ground up in terms of return to play. And then after that, took a job with the Washington Spirit, and I was there for a year and a half. And actually, this week I'm transitioning into private care, and I'll be starting up next week in that role. So have been kind of all over, and am from the Maryland area, and now have returned to the Maryland area for private care. So I'm really excited to eat a ridiculous amount of Old Bay all the time.
Love that. You've been all over the place. Very impressive.
I have, yeah, a lot of states in a short amount of years. So before this podcast started, we were talking about buying houses. I have yet to do so because I've yet to be able to stay stationary, but I'm hoping to get there soon.
Maybe this is the time, the place.
I know, yeah.
So you talked a little bit briefly about kind of pros and cons of places you've been that had like established return to sport testing protocols and places that didn't. Do you want to touch maybe a little bit more on that?
Yeah, for sure.
You've seen, I know you've worked with a lot of different sports and settings. Like, are there certain sports or organizations that maybe have more set return to sport protocols compared to others that you've noticed?
Yeah, for sure. I mean, I think like you can just tell with like more longstanding organizations that, or even like something as small a detail as like how long has that director been there, the director of like performance or health, let's say, because if that person's been there for 5+ years, they've probably got their system down pat versus like the XFL example I gave. That was the first year of the league. So the vice president of health and wellness, shout out Carrie Gordon, and if anyone knows her, she really like empowered us as a staff to do what we thought was best as far as RTP testing went, or performance testing, rehab testing, all of the above. So we had a staff of myself, a couple of strength coaches, a sports scientist, another PT, and it was really on us to come up with what did we genuinely think brought value as far as testing, and they were willing to invest in that. Now, to your point, like other organizations, sometimes it's, okay, they've been doing the FMS for 10 years. They're going to do that no matter what. And are those places open to adding? Yeah, sometimes, but it's more like it's a little harder to make changes at those places, which isn't necessarily a bad thing because those very places are the same places, which I think we'll get to when we talk more about testing. But those are the places that taught me the fundamental lessons of like consistency, reliability, and validity of your testing because they had been doing it for so long. So those are principles that I took to the next places that I went, just with running different tests sometimes. So I think as long as that consistency carries across, that's like a valuable lesson to take away from the organizations like that.
So when you're looking, you touched a little bit on the like validity, reliability, consistency aspect of it. When you're looking at getting KPIs, what are you looking for in your like return to play, say, with I think it probably helps to give a little context. So let's say in the XFL situation, because you were helping build that out and you were empowered to do your thing, what did that look like for you?
Yeah, I mean, it's again, this is going to sound annoying. I'm going to keep harping on principles, but it really always comes back to that because my big thing with testing is what do you want to measure? Why do you want to measure it? And what are you going to do about it? Because I think there's a few like key places testing goes wrong. It's collecting information for no reason, or you're collecting information, but you're not doing anything with it, or you're collecting data, but it's not good data. So I think
Mhm.
like starting with that mindset of, okay, what am I collecting? Why am I collecting it? And what am I going to do with that information? And that kind of helps steer you towards what to collect. Otherwise, I mean, anybody that's been on like Vault or any sort of force plate system knows there's like an endless amount of metrics, and there's now also an endless amount of tests. Yeah, like hamstring, for example, you could test at 30, 60, 90, prone, seated, on the force frame, on the dynamo, ISO push test, ISO pull test. There's so many options. So it's really like, what are you after and why? What does that help you do for their training programming or the rehab programming? And what are you going to do about it? Um, Hopefully that answered your original
Mhm.
question, but
Yeah. So then when your principles you kind of talked about in that with someone with like a hamstring strain,
mhm.
is there some, like, I guess, could across all muscle strains, are you looking like, okay, here's generally what I want, and then in like a ligament injury, here's what I want? Or how did you conceptualize piecing together what that looked like?
Yeah, I think it's a little bit of both, like the injury, but also the sport they're getting back to, which seems
Yeah.
obvious, but there's some tests that I think are more conducted based on like, okay, because of the sport, this is probably a good test if you're really doing rehab in like a holistic way. Because if you were just injury specific, I think that would lead to things like, okay, for a hamstring, I'm just gonna do knee flexion isometric test at maybe 30, 60, and 90. But when you look at like the sport as a whole, that's probably what's going to lead you to be like, okay, I should also do a counter movement jump, a drop jump, a single leg variation of both of those things. And then depending on what else the sport kind of dictates that testing as well. So to answer your question, I think it's a little bit of both, but there definitely is some element of like, in the ACL world, there's this battery of tests, but that's not to say that some of those tests aren't also in the hamstring one. It just kind of dictates when you do them and why you do them, I think, because that's another point is some of the tests can be introduced at various times in different rehabs. Like for a drop jump, that might be a whole lot harder for like an Achilles calf injury versus a hamstring injury. It's also knowing about that and like when to introduce those things based on the injury.
Yeah. No, yeah.
During your time with sports, did you feel like there was a lot of like mostly return to performance testing or preseason testing? Like I've been working some with football and I feel like, you know, they want to do a lot of this like injury screening, they want to
Yeah.
do all this like, bulk data collections. And to me, that's kind of where I see people get lost in like, what are we doing with this data? Which metrics are we looking at? Where I
Yeah.
think it makes a little bit more sense in a rehab context. We're looking at symmetry. We're looking at, it's a little more fine tuned. I don't know if you had similar experiences with sports or your kind of thought on like, injury screening to
Yeah. Yeah.
predict injury as opposed to I'm biased to I like it in the rehab context a lot more because it just makes more sense. But
That's a great point and something I've never like actually addressed verbally, but now thinking it through, I do like baseline measuring, but almost for the purpose of what you said and not for injury screening. I wish we could say that we know drop jumps threshold will actually tell us who's going to tear their ACL, but like there's just too much telling us
yeah.
there's no way. Injuries are too complex. Do I in general think it's a good idea to get baseline screens as far as some of these like athletic measures on athletes? Yeah, absolutely, if there's the time and resources. Going back to our original point, I think the mistake is when we collect every single test humanly possible, and I've probably fallen guilty of that a time or two because we had the resources and think,
Yeah.
okay, let's do this test, let's do this test. The problem you run into is like, do you have the time and the resources to individualize based off of that? If you do, great, go for it. If not, probably don't bother the athletes with it.
Mm-hmm.
And I have been a part of situations like that where it's like, dang, we didn't get to do as much with the data as we thought. I will say on the rehab side, it is a hell of a lot nicer to have pre-injury baselines than it is not to. So, because my big thing in RTP and like rehab testing is you can do LSI, you can do standard or comparing to standardized norms or whatever norms are available. Vald has a lot now for like certain demographics, but having their pre-injury baseline and having a trend for them, like if you're fortunate enough to work with a team or an athlete for like a year plus and collect serial data, it's super, super helpful to see like, okay, is this just their norm and their strategy, or is there actually something going on here? And just having players that like, 6 months into a season, then they get injured, you have 6 months of data pre-injury to compare to, and it's super helpful to have that instead of just looking at LSI or comparing to norms on some research paper.
You said something in there, Azita, that was really kind of mind-boggling to me. Is like we can't predict injuries and stop injuries from happening. I was on social media today, and I must have read at least 30 people who could stop Jason Tatum's calf from Achilles from tearing. Like I've been doing Achilles rehab for a long, long time, and I must be living under a rock because I don't know how to stop it. So I need to reach out to some of these people and figure out how to do it because it's crazy.
That would be a whole nother episode there, is talking about people that think we can definitely, and like I want to think we can improve certain athletic qualities. We can improve things from a rehab perspective, movement quality perspective. Awesome. But is that necessarily going to prevent an injury? No, we can't say we're going to do that. And
especially without even seeing the guy, looking at his body, seeing that, it's like, oh, I could have stopped that Achilles problem. No problem.
With calf raises.
What are you talking about?
Yeah, no, I don't know if any of you saw Quinn Hennock's post about that, but I was like, I can't, having worked in sports, I can't relate more to seeing people like comment thinking that they know what goes on behind the scenes in professional sports is hilarious to me.
Quinn's comment was one of the ones that kind of sparked that question, but literally there was like 20 posts I read today that were people telling me and telling the world that, go to their course, they'll teach you how to stop an Achilles tear. You know what I mean?
Oh, gosh. That's so sad.
Yeah.
Good marketing strategy, though.
It's ridiculous.
Yeah. I think back to, oh, sorry, go ahead.
No, I was just going to say, I think in the sports world, it's so important to realize like there's a risk involved with sports. Injuries happen. We can do our best to try to minimize those risks, but they're going to happen. Right. So I think to put a blanket statement out like that is very, I think it's detrimental to the society as a whole because people start to believe like, hey, maybe I'm not getting the right care because I had this injury happen. And it's putting unreal expectations on athletes and from the coaching staff, down through like, hey, how are our athletes always getting hurt? Shouldn't we be able to stop this? Well, the answer is we can minimize it, maybe, but we really can't stop it. So anyway, I digress, but sorry.
Right. No. Yeah. And the sad part is like athletes get fed that as well from those very people that are posting on social media. And then they start to wonder like, well, why didn't you guys stop this from happening? It's like, oh man, if I could do that, then I probably wouldn't be working anymore.
Correct.
Yeah. You'd be rich.
Yeah. Yeah, exactly.
Also, we probably wouldn't have jobs at this point, but
yeah.
That's right.
That's fun.
Yeah, exactly. But I mean, going back to the point, like, I don't think the point of baseline testing is to prevent injuries. It's to find areas of opportunity for development and to address anything glaring happening and to find a better way to individualize programs or guide your programming. Like that's the point of it, not necessarily because it's there's a magic formula that says if you do this, this, and this, that means this outcome is going to happen. There's just no way. But I don't think it's that invalidates why we do it. Again, it all goes back to why, and I think there's much better reasoning than claiming we're preventing injuries.
Do you do a lot of fatigue testing during the season in your various roles? Like using using force plates to generate, assumptions as to where the athlete is and how much rest they need. And perfect. Yeah,
for sure. Yeah. And that's something, and it's funny because like, that's not really a part of the physical therapy profession, right? But being in those kind of like hybrid roles or environments that allowed me to do a little more with testing and monitoring, for sure. Like that's something that I believe in. And the big thing for me is, another principle of mine is like nothing in isolation really means anything, whether that's one metric on a test or one test alone. So even like you look at counter movement jump as that assessment of like neuromuscular fatigue or central nervous system fatigue, even that alone to me, like let's say it did drop 20%, that's not an end all be all. It's like, well, where's their wellness questionnaire at? What are they saying subjectively? What about their other objective metrics? Because nothing standalone is really going to guide anything. It's more being able to recognize patterns and knowing that athlete. Like we've had athletes that I've worked with where like they traditionally just don't do well 2 days after the match, whereas other people are recovered, but we just picked up on a pattern of like they needed a little more time and then they were good after that. So a lot of it even comes down to knowing the athlete and knowing what day you're testing on, and again being standardized in that as well.
Yeah, and you don't know that unless you take serial measurements, right?
Exactly.
Like, you got to figure those patterns out, and I think something that you touched on too, that like you taking serial measurements help you build your own database versus comparing to other people's data. You don't know their standard approach to things,
Right.
and like how good are they about, systematizing, and are they being valid and reliable with how they're doing that?
100%. Yeah. And that's something like with my role from the Spirit, I learned a little bit more about from our strength coach of like, obviously cueing is important, but even your setup, like people say they're doing maximal testing, but if your setup isn't allowing for maximal output, then you're not. So some like an example of that is like the knee extension seated isometric test I used to do, or I still do. I didn't used to have them grab the table, but once I kind of talked to him about that, I was like, wait a second, if I really want to get that max output, I should let them grab this table for sure. I was always strapping them down, but the table grab was just like a slight change. But again, it's like, what are you truly trying to measure? And then that dictates how you set it up.
Yeah.
Going back to the force plate, because I think this is sort of like a hot topic. People talking about the serial counter movement jump testing.
Mm-hmm.
Could you go over sort of what metric you're looking at? Is it just jump height? Or are you looking at impulse? And then for like thresholds, at what point are you maybe holding people, or you said 20%, I don't know if that was just an example or if that's
That
like
was just an example,
the threshold that you use. And then like one step further, do you feel like athletes, sorry, my dogs are fighting in the background. Do you feel like athletes are compliant with like, hey, you probably need to sit out or take more rest?
Yeah, I'll actually
because I feel like that's sort of a hard like thing. You maybe don't have evidence like, hey, if you play or you practice, you're going to get hurt. And we've gotten some pushback from coaches and things like, we want this person to practice or play, and maybe sports science and staff are like, okay, this person might need a rest break, and there's sort of this disconnect between that little collaborative bubble.
Yeah, I'll start with your third question because I think that honestly drives a lot of it. I think it's less often the athletes that question it and more often coaching staff. Because for them, like a lot of this is so new. Like, what do you mean the athlete jumped 15% lower? I don't care. Like they could still play. So I think it's still like it's going to take time. And going back to our point about people think they know how professional sports work, we do educate coaches. You educate them, you provide all the education in the world, but at the end of the day, it's pretty much their decision whether or not they want to believe in that or not. And I've been in places where they do, and I've been in places where they don't. So a lot of that will drive, can you do anything about it? And so then that probably in reverse dictates whether you do it or not. Because you don't want to go and and this is like the reality of sports, you don't really want to go make athletes do this jump testing if in reality it's not going to change anything about their loading. From like the fatigue perspective, this is kind of separate from baseline testing and for the purposes of like RTP. But yeah, going back to your original question, jump height definitely a part of it. I'm big on looking at kind of three parts of the jump, like that output, the jump height, the drivers behind the jump. So for me, that's concentric impulse and eccentric deceleration impulse. And then their strategy. So for me, that's counter movement depth and eccentric phase duration. So it seems like a lot, but once you've, I think, done it a good amount, you kind of get a little quicker at looking at these. And that goes back to the point of like nothing in isolation means anything. Because if you just looked at counter movement depth, you'd be screwed, or even just eccentric duration. But it's looking at, okay, did they shorten their eccentric deceleration phase? Like they're dropping a lot faster into it, but their depth was cut significantly more? Are they going a lot lower, but it's taking them a lot longer time? Or did they truly go the same amount of depth, if not slightly lower, in a shorter amount of time, which would be the goal? But using that as a like kind of a touch point of like, what is their strategy looking like? Because if you just look at jump height, again, a lot of things can change there. Even impulse alone is a tricky measure because, again, it's did they change the time in which they were creating that force under the curve? So that's why I kind of say looking at those three things. I know a lot of people like modified RSI or jump height, contact time, stuff like that. Again, that goes into like, then you have like 8 metrics you're looking at. So do we look at those? Like, do I look at those? Yes. But I would say the main are those like 3 categories, which kind of give you like 5 or 6 variables to look at.
Yeah. Are you looking at, for the impulse, are you looking at total impulse or peak or both?
Peak for eccentric and concentric. And then this adds 2 more metrics. I look at the asymmetries in both.
Sure. Yeah.
Especially just in the context of, like, for example, in soccer, that's kind of important.
Yeah.
And then especially if it's like an RTP case, then tracking that over time. But hopefully that wouldn't be present at that point.
Yeah.
Do you feel like there's certain sports that are better at this? I feel like soccer is sort of notoriously really good. And you know, maybe like football or maybe not as good, at least at the collegiate level.
It's tough because like I used to think like soccer was big on GPS, but now so is American football, and they're catching up. And then, but then the NBA is like super into all of this also, and then baseball is like worlds ahead in biomechanics for sure versus other sports. But at this point, I feel like it's less about the sport and it's more about the leaders in that organization and what they believe in. Going back to like our original conversation.
Yeah. I feel like baseball is such a unique sport where you kind of do repetitive things that are so similar each play, as opposed if you're looking at soccer or football, there's so much more variation of what's happening. It's probably so much easier to track and collect data because it's like the same movements over and over and over.
Yeah, and it's interesting you say that because the Cardinals was the organization where they had their processes like down. Like they had been doing it a while. And like you said, it's kind of like the sport. It's things over and over and over again.
Yep.
Yeah, that's fair.
Trying to think of what was your reason for, or what have you noticed in terms of your own journey jumping around from different sports? Like what drove you to kind of go from football to baseball? I know this is kind of getting out of the testing kind of question, but
that's great.
It kind of drives kind of a little bit of what interests you and maybe how you kind of go about doing what you do, right?
So that's a great point. Let's see. I started in football after private practice because I had done actually before that a football internship with Maryland football and under their strength and conditioning. And that's what actually like started, because I started that internship with the intention of learning about strength and conditioning so I could apply it to physical therapy. And then I left there wanting to be a strength coach. And a big thing I saw was, holy shit, people have no idea what it takes to be an athlete. Like I didn't know. And it's things as simple as like seeing the kids that they had to wake up at 5 to go to their first lift of the day or their first training session of the day. Then they had to go eat breakfast and go to class for 6 hours. Then they had to meet with an academic advisor. Then they had a PM training session. Then they had to do media. And it's like, I didn't realize how much load there is just outside of the actual training itself. Or even like people look at what happens on the field, but what about the load through the weight room? Like that itself matters as well. So it kind of taught me like, oh, wow, maybe a lot of this is the reason why we fall so short in RTP is we don't actually know what it takes to be an athlete, especially physically. So going back to your question,
a college athlete, I think is even. So I was talking to one of my jumpers today, who's a professional jumper. She just graduated as a professional jumper. And I said, so how do you like, no longer being in school? She goes, oh my gosh, you would think that, since turning pro, I would have, to really kind of work on my craft a lot more. She goes, I have so much more time. I can rest and recover so much better. She goes, my life as a pro is so much easier than my life as a college
For
competing
sure.
jumper because of all the different directions I was being pulled in. And it brings up your point about recovery, right? Like, are these athletes truly recovering? And when you're talking about, your return to play metrics, your fatigue monitoring metrics, and how it's more than one thing, all of that kind of plays into the picture, I say.
For sure.
Well, Brian Mann, presented at CSM last year, and he was saying one of the biggest, I can't remember if it's related to velocity loss or injury prediction, was essentially whether or not somebody had an exam. It was like academic stress was like the biggest thing that was driving some of that, either fatigue or, injury prediction compared to what they were actually doing on the field.
Cortisol.
Which is kind of crazy.
Right.
Yep.
Uh-huh.
Right. I feel like we're getting away from the question, but I think this is good because I think also a lot of people think in sports, like, their lives are so simple that the complexity of injury is taken away. Like, if it's a hamstring strain, it must be because there was an asymmetry, or because he had too much anterior pelvic tilt, or she had too much anterior pelvic tilt. When in reality, like, chronic low back, I was just having this discussion with like a mentee of mine today. Chronic low back pain is looked at this very complex thing. Like, if that's established in the literature, psychosocial factors, biomechanical factors, lifestyle factors, all these things, when in reality, like, for professional athletes, that's only heightened in terms of any type of injury, whether it's a hamstring, a lateral ankle sprain. Even if the ankle sprain was a plantar flexion inversion mechanism, so much more goes into it than that. And I think that's what people don't get is, it is that complex a lot of the time. Sometimes maybe not, but it's not as simple as one thing happened, or because they're professional athletes, everything must be perfectly right in their personal life. So there's no way that stress impacted this, or that they didn't sleep the amount of hours they should have, because they're athletes. Of course they do. They don't always do that. And they don't always eat what you tell them. They don't always do everything the textbook way, because they're humans. Like, there's no way to. So it's definitely still as complex as, like, we make chronic low back pain out to be, for example.
Yeah. So then when you're dealing with complex humans who are performing at high levels, and your job as the strength coach or the PT or the performance PT or whatever
it is.
Yeah, exactly. 5 million labels these days. You're trying to select these metrics that are going to inform your input to that athlete.
Mm-hmm.
And you have to convince them, hey, here's what we're going to do, and here's why we're going to do that. I guess, how has that process evolved for you? And like the selection of that into the, like, convincing them about that, right? Like, getting the people to do that. Because if you have someone do a counter movement jump and they don't care, it's like, well, that doesn't help my valid and reliable metric if they just don't care. So what strategies have you found in working different sports and things like that? I'm sure there's some through threads that you've kind of gained in working with high performers.
Yeah, that's a great question. It's funny because I haven't had to do much convincing, and I'm probably fortunate in that, but it's because, like, especially at the professional level, they're so ingrained into this already that they almost, like, don't question it. Like, they've been educated plenty. Some of them know more about testing than other PTs might, to be honest. Like, they'll come look at the metrics and be like, oh, I'm good there. Oh, there. So a lot of them kind of know and have been through it. Like, talking about the Cardinals organization, for example, those guys have been doing it.
Mm-hmm.
So I think more probably where I've had to get the buy-in and explain is if it's like in an RTP process or in a rehab process. Not necessarily like fighting it, but more so like that they're fighting it, more so me wanting to educate, to your point, because motivation does change testing outcomes. Like, there's research backing that. So you're cueing how motivated they are. So I try to be consistent in that. But, like, on a human level, I want them to know what I'm looking for and what the goal is, like, for their programming. So an example of that, like an X's and O's example in the ACL world, this is just how I do it. There's a million different ways to do it. But when it comes to jump testing, typically what I've seen and, like, how I like to go about it is kind of like clearing the eccentric or loading phase first, and then worrying, and the symmetry aspect of it, and then worrying about, like, the concentric output And then at the end phase, kind of worrying about like the performance output, like the elasticity of the jump and the jump height and kind of more of those metrics. So I kind of look at it in 3 phases. And when I explain that to the athlete, then the first and second time they jump, when they see that their eccentric deceleration impulse has improved and that their symmetry is below, or asymmetry is below 10% in that phase, and that their counter movement depth is normalized, and so is their duration of that phase, because we have the pre-injury baseline data, they're not worried that their jump height is down, because they understand that that's not what our programming has been targeting, and that there's kind of like a method behind what we're doing. So I think it's more having conversations like that, so they're in the know about their own data, which they should be.
Yeah. Yeah, making it salient to the human in front of you.
Yeah, exactly. And like, you never want to like take a test on an athlete and then turn the computer away and hide it. As busy as we are in the sports world, I always try to sit down with them that day, if not the next day, with the computer, with the results right in front of me. Sometimes they see things they don't want to see. Sometimes they don't. Sometimes they do. Sometimes they're happy. Sometimes they're not, but they're informed. And I think they always appreciate that. Where, I could admit when I make mistakes. When I make mistakes is when I'm so busy that I don't get the time to sit down with an athlete and be like, here's what I saw. So I always try to make a conscious effort to do that. And that goes back to the point we were talking about earlier. Don't collect so much data that you can't act on it because you're paralyzed by the amount of information.
Yeah.
Jesse Ellis. Are you familiar with Jesse Ellis, guys? Jesse Ellis posts a lot of stuff, about, the tech side of it. And it's really good stuff. And it brings to light a lot of the things that we're talking about here, like, hiding data, getting buy-in, is that data going to be used against them? Is it going to be used for them? So interesting stuff.
Oh yeah. I've dealt with athletes that a few times that didn't want data collected for that reason, because that was a big fear when like GPS started, is that it was going to be used against them. So I totally get that. And again, another reason to keep them informed so they can hopefully separate those fears from what you're doing with them.
I think too, like you were talking about with the serial testing, I found a lot of benefit, I treat pretty much only ACLs, but if you're testing regularly, there's really no surprises typically with how they're doing. And I've run into issues where I see people who have maybe been at a different clinic and they're, nearing the time where they're thinking they're ready to go back. And then they come get tested with us and they're just way off the mark. And that being blindsided, like, no, you've still got whatever 5 more months probably.
How are you testing? Are you talking Biodex testing?
Yeah, more strength type testing.
So how much of that is due to those that aren't getting tested frequently being familiarized with the actual machine and isokinetic makeup versus the actual strength deficit that may be there?
That's a good question. I think it comes out in the wash because you're going to have that learning thing bilateral, right? Like, you're not going to know how to test probably on either side. And also, if you start digging and asking what they've been doing in rehab, it's pretty apparent that they have not been doing the right things. Whatever. I digress. But it's not typically in my opinion and what I've seen like a testing familiarity issue. But it's definitely like the athletes just don't know where they're at and they have a false sense of feeling like they're farther ahead than they are.
For sure.
So I think that's a huge benefit to it for sure. Like having somebody on staff who can test you regularly and kind of let you know where you're at.
But that's a good point you brought up about like their programming, because my big thing is take testing away. We should still be able to do our jobs and figure out a way to assess athletes. So like, I think for me, my first job as a strength coach, doing like a lot of the RTP stuff was with Louisiana Tech football. We did not have any resources, despite it being Division I college football. We didn't have force plates. We didn't have handheld dynamometry. We were in Ruston, Louisiana. There was nowhere I could send anybody remotely close. So still figuring out a way, like that's why your process guides you, and having a coaching eye, knowing what to look for, knowing that it's not just about horizontal hopping, that you need to train the vertical and you need to do this and you need to do that. All that stuff, you should be able to train somebody to hopefully send them to somewhere to get tested and not be in a spot like that. Like, can you see the 15% asymmetry? No, absolutely not.
Yeah.
But knowing what happens in a typical rehab process, whether it's an ACL or hamstring, whatever,
Yeah.
implement strategies to address that proactively to hopefully put them in a better spot. And I
Yeah.
think that's a big thing, is like, hopefully people aren't becoming reliant on technology. Like, you would
For
want to
sure.
be able to do your job without it, and then just use that to enhance so
Mhm.
that we're not guessing, we're assessing, and being
Mhm.
more accurate with that. But definitely don't want people, you know, like, people could have technology and still put together really crappy programs. So you
Mhm.
want to make sure you're kind of doing
Yeah.
both.
That is completely true. It's like, I think if those people had come with me and had really good rehab, I mean, they probably would be fine. But
Yeah.
yeah, a lot of underloading happening for sure. It's
sure.
like,
Yeah.
once people can start running, it's okay, no more strength training. We're just gonna
Right.
Yeah.
Yeah.
jump around. It's like, well, your jumping's not gonna get better with the baseline strength that you have. Just
Right.
continuing to
jumping.
jump is
Yeah.
not
Correct.
not enough on the system.
For sure.
I got a question
I-
for you. Oh, go ahead, Owen.
Oh, I was just going to say, I think this whole conversation, and Azita, what you were saying before, comes back to like, why are you testing and what informs your testing in terms
Yeah.
of like what underlying qualities are informing your testing. So you were like, I really like to clear eccentric impulse in a counter movement jump, and it's like, well,
Mhm.
how is there you know, isometric force production? Because if that's crap, your eccentric force production is probably not going to go great. So like,
Exactly, yeah.
let's clear your bottom pyramid levels. Like, hey, is your range of motion
Yep.
full? Is your effusion gone? Can you know, get a steady torque production without like vibrating the whole humac or
Right.
Tindeck or whatever, right? Like, and so you're just going, but I think a lot of people just see sexy force plates and they're just like, ooh, look at all these metrics and numbers. Like, I'm informed, right?
Mhm.
No, and
yeah,
that's a really good point, and like tying both of your points together, I think that's exactly why, like, I'll just keep using ACL as an example.
sure.
Why testing is introduced at various times versus just like kind of throwing it about. Like, for me, if I'm doing let's say they're not at biodex yet, or you don't have it available, and you're doing seated knee extension isometric, if they're at 60%, I'm not going to have them do a counter movement jump
Right.
because we haven't cleared that pyramid, and we're just going to have
Yeah.
them jumping on a crappy crappy foundation.
Yeah.
So to that point, it's like, okay, when do you this is where like repetition comes in, is like knowing when to kind of introduce. Yes, you can write it on a piece of paper and say, when they are at 80%, I will do this test next. But a lot of it comes from just understanding physical qualities and when it's
Mhm.
appropriate to introduce something.
Totally.
Mhm.
Yeah.
So, with regards to your program, Azita, you know, obviously in the physical therapy world, we are usually working, you know, in unilateral positions, isolated,
Mhm.
you know, single leg, really obviously concentrating on both, but in isolated fashions, right? In your strength training background, have you seen, or how did you kind of, going backwards, like, do you do your programming working primarily on big compound movements, bilateral things, or are you actually breaking it down and doing some single leg stuff? Because I found that that's one of the things where, like, I find myself now doing a lot of the unilateral things where they start getting reintroduced to the strength world, where they concentrate mainly on the bilateral or compound movement
Right.
type of things. How have you navigated that, being on both sides of the fence?
I'm gonna be annoying and say both. I think like
Okay.
early on in processes, I certainly lean towards single leg and isolated. I think we all know at this point, like, you got to do open chain knee extension, load it heavy. But it's also nowadays, I think, finding different ways to load and understanding different contraction types. So like big tools for me are like flywheels. Like, those are a huge game changer. You kind of, at a certain point, you're gonna max out isometrically. Like, you can only do so much isometrically. And then it's like, okay, when can you introduce overspeed or isometric or sorry, eccentrics with a flywheel, or reflexive eccentrics, and kind of
Mhm.
progressing them through that phase. But early on, I think doing both, but certainly biasing towards single leg and isolated, so we can actually drive that peak force production up. And then once they're at a point where it's like, okay, like, now let's start doing some heels elevated goblet squats, some RDLs. And there's certain movement patterns where, like, I think you can load them a little earlier.
Mhm.
Like, for example, if it's an ACL, let's say no hamstring involvement, I'm a little more willing to like go a little more aggressive on RDLs versus split squats. Because on the split squat side of things, I'm really trying to hammer isolated quads first, rather than really caring about the split squat aspect of
Mhm.
it.
Gotcha.
Yeah, I was going to ask too, sort of going along the lines of like, you being a strength coach, PT. I'm always curious, like you've been a PT for what, 5 years? Is that
Yeah.
right?
Yeah.
Okay. Like what do you think has been your biggest shift in maybe opinion or the way that you approach testing and sort of some of your ideology over the last maybe 5 years?
That's a
Because
good
I feel like
question.
as we
Specifically
start to
about,
get into it, you start to get stronger opinions on things that maybe when you're a student, you're kind of like, oh, I don't know, I'm just gonna.
that's funny because I think my opinions have actually gotten like less strong, if that makes
Maybe
sense.
it's a bell-shaped curve. Maybe you like become more open and then you close back down again
I've been
once
told
you
I'm
hit 10
stubborn, so I
years.
think I started out more stubborn and I'm becoming less stubborn. But I think a lot of that is like early on, I think I was so like the research says this and it says this because you don't have practice to rely on. And I'm
Mhm.
saying that like I've been practicing forever. I haven't, but then you just see things clinically. Like when it comes to testing, the research might say that a certain test means this, but like when you see it in practice and you're like, oh no, like so many things go into the test other than just that, then
Yeah.
you can interpret it a little more than because research is just that. It's in that sort of setting and like usually those practitioners will tell you they're not in the applied world and there are specific examples where they are and those are a little more applicable, but usually if you hear someone behind a research article talking on a podcast they will say that it's a much different in the applied world in real life. So I think early on I was much more glued to like the X's and O's and what things had to be or what the research said they had to be, and manual therapy is terrible, and I came up in that camp, and then now I'm like,
Mhm.
oh no, I mean, like if an athlete wants it and they say it helps them, so I can do
Yep.
that as long as we can actually do the things we want to do. As far as what I've changed my mind on the most do you mean in terms of testing or anything?
Sure, anything. It could be anything.
Anything, I think it would have to be manual therapy because I think I was so just I don't want to do it. Like in PT school, we had a really good musculoskeletal professor group, and both them and Therex, they were very good. And so I really came up like understanding that side of things, and I believed in it. And then I got out of school and was like, no, manual therapy is so stupid. I don't need to do it. It doesn't make any difference. We don't know what vertebrae we're at. And then I realized it didn't actually matter. And if it makes people feel good, it makes people feel good.
Mhm.
So I think that was like definitely a big change for me, especially over the last 2 years, because I think we can all attest to this. It's only enhanced in the professional world, and if that's what
For
they
sure.
need,
Yeah.
then that's what they need. A funny example of that is like dry needling. I was skeptical of it, and then I went to my first class, and like I couldn't rotate my neck past probably like mid clavicle line for whatever reason. And then I was the example for that. And after they needled me, I turned my head all the way and was like, oh shit, this might actually work. and
Yeah.
and like that's somebody going in who didn't believe in it. So
Mhm.
is it the effect of like placebo or me having the preconceived notion it was going to work? No, it for whatever reason it worked. So I think just understanding like how our hands can make a difference, or needles or whatever it is that can make a difference, is big. And then yeah, on the testing side of things, I think same things, more like learning to explore. And like the research might say that peak landing force is a good metric. For whatever reason, I've just found it to be a little inconsistent and unreliable. I don't know why, but I don't look at it unless I see a pattern. And this is just an example, but it goes back to like the textbook world isn't everything in real life. So if there's metrics that you find to work in your setting for your team with your set of force plates, cool, then use it. Like there's a reason that the force plates have them available. So I think it's being more willing to trust your instincts and kind of explore outside of what just the experts say or what like research tells you to do.
Azita, I think your first example talking about manual therapy actually has a nice tie-in to key performance indicators and outcomes, because you're giving someone an input, a treatment. It's just not bench press 3x5 with a 101 tempo with back off 2 more, right? You're doing whatever,
Yeah.
high velocity manip. You're doing dry needling, and then your outcome is like hopefully salient and hopefully improving performance. And at some
Right.
level, professionals' confidence and feeling quote unquote good is hopefully making them play better or
Right.
being able to play better. So I think there is some tie in there. I
Yeah.
think sometimes people get a little dogmatic and like it has to be this manual thing.
Yeah.
Whereas I think patient preference and your confidence play a big role.
100%. There's times
Yeah.
where like I'm like I don't think this technique is really doing anything, and
Yeah.
if they love it, then I'm
Right.
like, okay, I'll do it then.
Yeah,
Sure.
yeah, sure.
Yeah.
Yeah.
My big thing with manual is like, can you guys hear me?
Yes.
Yeah.
My sound feels weird on my end. Is like maybe 12 weeks later, it wouldn't matter if you did it or didn't.
Yes.
Like, say
Yeah.
your neck pain. But when I'm hurt, I want to feel better right now.
Yeah.
And so does everybody else. So
Yeah.
it's like,
Yeah.
okay, I don't care that in 12 weeks my outcomes are going to be the exact same.
Right.
If you needled my neck or you didn't. But when somebody is in pain or having issues, like getting some relief, even if it's acute, is like so beneficial mentally.
Right.
But that is why I like manual therapy. You know, the context and maybe how people describe why it works or whatever. And again, like down the road, it probably wouldn't make a huge difference. But
Right. But
I know when
I
I'm
think-
hurt, I'm like, rub it, do anything. Gosh,
Yeah.
please. I'm like,
I know.
manipulate it. Oh.
But I think that ties in nicely with what we were talking about for testing earlier. Like motivation does matter, and it's
Yeah.
going to dictate outcomes,
Sure.
whether that's with testing or whether that's with what you do on the table. It's really in rehab and all of life, motivation and preconceived notions matter. So I think that's a really good point. And then the other point I want to make just about, since we got onto manual therapy, is like what opens up a window or lowers the threshold that the athlete's feeling for you to allow you to implement exercise
Whatever.
prescription in a
Mhm.
better manner. So if you can lower that threshold in order to allow them to do XYZ, great. I think that's how I try to order things now. Like, do we end on manual therapy sometimes? Sure. But I've just kind of picked up on that over time as well as like, oh, it's actually really nice to start on this so that we open up your ankle joint so that you can reinforce that with mobility and then through loading and then maybe through
Mhm.
higher ballistic activities and kind of have more of that like order in your head.
Mhm.
Yeah.
Agree. All right.
The manual
Does anyone
therapy at
else
the
have
end.
any-
I was gonna say the manual therapy at the end makes them feel good before they leave, make them want to come back, right?
I know, yeah. See,
Uh-huh.
that's the tough part, but I've never really had to like function like that.
It does.
You
We'll
will.
see,
You
I'm
will
going
in
to
private
private practice
practice.
now,
Just
so-
wait.
Yeah, no. I know.
So-
I think it's funny. We started talking about testing, and we ended up on manual therapy somehow,
That's
which is
No,
not something.
that's
I
just
talk
the
about
beauty
often.
of organic conversation, I guess.
Yeah.
But I was
I
gonna
mean,
say
I
we
think-
will. Sorry,
Sorry,
go ahead. No, you go.
I was just gonna say, I think my big thing on testing, like for PTs or whoever, is just what we started with: be consistent, be reliable, be valid. The big things, like there's so many good courses out there now, but be consistent with your setup, be consistent with your cueing. Those are the things. Make sure your equipment is calibrated. Like those small things do make a difference. I mean, cueing and setup are big things. And be standardized. Like that's the huge thing. It sounds corny, but like I have written out instructions for every test that I conduct to make sure that it's the same way every single time. Make sure they have warm-up reps. Like what I use is 50% and 75% before 100% effort. But it's that stuff that then makes your data more reliable and more valid so that you can go interpret it and take action on it. But I think people are so worried about like what tests do I do and what metrics do I look at, whereas like I think the big thing is focus on how you are doing, even if it's just 2 tests. Focus on how you're doing them.
If you had one piece of tech, Azita, what would it be?
Ooh, I'll go with, this is gonna be a surprising one: the force frame from Vald.
Interesting. Okay.
Yeah,
Why?
because I can get knee extension on it, but I can also get like, I think it's a little better for stuff like seated calf and hip abduction, adduction.
Sure.
You can get that with the handheld dynamometer, especially if you're doing like a pull tension link test. But I think it's also, yeah, it's very versatile. I'll say that.
Mhm.
And the great thing about that, Dynamo doesn't have it yet. I use mostly Bald. I always have. and I've emailed them about this, so I'm waiting for it, but they don't have a training feature yet, whereas the fourth frame does, and that provides you biofeedback, which is really nice.
Awesome.
Yeah. Cool.
Meg would have
Alright,
said the
well-
Biodex.
I would actually. I would say Humac because Biodex is going out of business. So
We can talk offline about that. I have some good gossip on that.
oh, nice. Oh, yes, please. But
Equipment
yeah,
gossip.
so we will be respectful of your time, Azita. But thank you so much for coming on. Do
Yeah.
you want to tell the listeners, viewers, where
Yep.
they can find you on the social medias?
Yeah, I want to say my username on Instagram is Azita Nej Performance, I think. But really, if you type in Azita, like, I should come up. Unless you
You're
know
in
other
of
ones.
one.
Yeah. And other than that, I mean, maybe this is old school. I use LinkedIn a lot. I love LinkedIn. So
Nice.
either one.
Find her on LinkedIn.
Yeah. But thank you guys. Appreciate it.
Yeah.
Thanks for coming.
Thanks. Yeah. it
Thank
was
you.
great.
Awesome. Thanks, guys. Hopefully talk to you again soon.
Sounds
Bye.
good.
All right.
Bye.
Bye.